So this is Candace. She is here 2 weeks status post and ACL repair. So we are going to do some electrical stimulation today. Hi Candace.
Hi.
I'm Sammi. I'm
Sammi.
an SPTA student at Carrington College. So today we're going to be doing some electrical stimulation, specifically what's called Russian protocol. So I'll tell you a little bit what that is. So Russian protocol is really for getting your muscle to contract. So that's what it's all about. So we're going to be putting some pads on you and you're going to feel like a tingly sensation. And then it's going to make your muscle contract for like 10 seconds and then we're going to relax for 50 seconds, okay? Because you're status post and ACL repair, so your quads, your hamstrings, everything's kind of asleep right now. So we're just trying to wake it up by using that electrical stimulation.
Right, I do have a lot of weakness.
Yeah, so that's what we're trying to do. We're trying to strengthen with it. Sound good?
Yes.
All right, so I'm going to ask you a few questions before we get started just to make sure you're a good candidate for this.
Okay.
Are you pregnant?
No.
Good. Do you have any blood clots?
No.
All right, so just so you know, we're not going to do any of the electrical stimulation over any big arteries or anything like that. Do you have a demand pacemaker?
No.
All right, good. Do you have any impaired sensation in this area right here?
No.
No? Good. Do you have any open wounds in this area that I should know about?
No. I had my stitches taken out, so they're good now.
All right, ready to go? Good. And then have you had a recent heart attack?
No.
All right, good. So we're going to do a few different parameters for Candace. We're going to do a single channel because we're only using 2 pads, a duty cycle of 50%. The cycle time is going to be 10/30 because she is subacute. Ideally, we would like to do 10/40, but this machine doesn't allow for that. So we'll do 10/30, so it'll be on for 10 seconds, off for 30 seconds. The burst frequency will be 75 because the quad is a bigger muscle. Ramp time will be 5 seconds. We don't want to do 2 seconds right now because that might be a little bit fast for her since we are in the subacute phase. And then we want to do 15 minutes.
Okay, so how we set this one up after we have our parameters is we plug in the cord number 1 because we're only using 2 pads. And then the way we connect our pads to the cords here is we just slide them on. It's going to be kind of tough, so that last little you have to give more of a push. And then before I place these on Sammi, I'm going to have her contract. So I'm going to have you push your knee into the plinth so we can see those quads. And then what I'm looking for is firm muscle because I don't want to put it on a muscle that's not firm because it'll cause some more discomfort. So keep pushing, Sammi, and we'll place our second one. And they're going to be in line with each other as much as possible and at least 2 inches apart. Okay, so Sammi, when I turn this on, you're going to feel some tingling. Just let me know when you start to feel that, and then I'll go slower until we see a muscle contraction. But I don't want it to be too painful, but we do want that muscle to contract.
Okay.
So are you ready to go?
Yep.
Okay. Are you comfortable in this position?
Yep.
Okay.
I feel tingles.
Nope. We'll go slower. Oh. Is that okay?
Yeah, you can turn.
Beating there. Let me know when.
That's good. That's good.
Okay. We're gonna push start. Okay, and then we are gonna, looks like it's gonna go again. Doing okay, keep breathing. It's gonna go for 10 seconds and then we'll go into our 50-second rest. While we're going into our 50-second rest, that next contraction, we're gonna do a little exercise with it. I'm gonna place a towel underneath your leg here. And then the next time we go into a contraction, I want you to push your knee into the towel here and with the contraction at the same time. So we're training the muscle to fire correctly
Okay.
when we're doing this, and then it also helps with the mind muscle connection as well. Okay, go ahead and push your knee down into the plinth there, contract those quads. I'm going to palpate. Everything looks good. Keep pushing. Keep pushing. Good job, Sammy. Almost there, and go ahead and relax. How was that?
That was good. That was a good one.
Okay, so we laid Sammy back for patient comfort and also to get her in position for our short arc quads, excuse me, short arc quad exercises. So what that is, Sammy, is once you feel the contraction go this time, I want you to extend your knee and then hold that position with the contraction. And then it'll be going for 10 seconds, and then you're gonna control movements back down to the plinth there with the next one. So here we go. It's contracting. We'll go into that extension. We're gonna hold. Perfect, Sammy. Keep holding, keep breathing. There you go. And go ahead and relax. Good job.
All right, Candace. So now that we are done with your electrical stimulation, I am going to give you a few home exercises to go through just so you can continue your healing at home.
Okay.
Sound good?
Yes.
All right, so remember those quad sets we did while you were getting the electrical stimulation?
Yes.
All right, so we are also going to do those at home, but I'm going to explain them a little more in depth. So at home, you can find a little towel and just roll it up like this. And we are going to put it underneath your leg. Go ahead and relax over it. And what you're going to do is you're going to press the back of your knee into this towel roll. So go ahead and do that. You're going to hold for 10 seconds and you're going to do it 10 times. And you can take about a 10-second break in between each rep.
Okay.
Sound good?
Yes.
And don't worry, I'll write all these down for you so you don't have to remember them. You're going to do the SAQ at home, the short arc quad, just like we did with the electrical stimulation as well. So at home, do you have like on your couch, what is this called? Armrests on your couch at home?
Oh, yes.
Yeah. So at home, you can like this on your couch and put your legs over the armrest, but we're gonna use this in here. I'm gonna put it underneath. Good. So just like this, laying on your couch, nice and comfy. And you're gonna press the back of your knee into here and you're gonna lift up your leg, straighten out your knee. You're gonna hold for about 5 seconds and then go ahead and relax, nice and slow down. Good. So at home, I'd like you to do about 2 sets of 12 of those, okay?
Okay.
Sound good?
Yeah.
All right, I'm gonna take this. Next thing we're gonna do for at home is for your hamstrings. So remember how I told you your quads are kind of sleeping right now from your surgery? Your hamstrings are as well. So I'm gonna give you a hamstring exercise too. So what I want you to do is bend your knees, both of them, so your heels are digging into the table, like this, good. And what you're gonna do is you're gonna press your heels down into the table and you should feel a contraction in your back here in your hamstrings. You feel that?
Yeah.
Good, so that will also be 10 for 10 seconds and you can do a 10-second rest in between each one, okay?
Okay.
Sound good?
Yes.
So go ahead.
I do.
You do? Good. So you can either, if you have somewhere that's slippery enough at home, you can just put a sock on and go for it, but for here I'm gonna put this pillowcase on you so it glides nice and easily. And then at home with a dog leash, you can put the loop through your foot like this. And I'm gonna hand this to you. And what you're gonna do is you're gonna slide your heel up and bend your knee as far as you can go. You definitely wanna feel a nice stretch, but you don't wanna be in excruciating pain, okay?
Okay.
And then you'll slowly relax back down. Does that feel okay?
Yeah.
So at home you wanna do about 20 of these, okay? And I'd like you to do all of these exercises twice a day if you can. All right?
Okay.